Singapore has reported 931 new COVID-19 cases, taking the total tally to 13,624. In its preliminary update, the Health Ministry says majority of the new infections continues to be migrant workers staying in dormitories. 15 new cases are Singaporeans or permanent residents. Now, Changi Exhibition Centre has been turned into Singapore's latest community isolation facility. Home to the Singapore Air Show, the centre received 50 patients yesterday. It's the third operational community isolation facility after the Singapore Expo and D Resort in TUC in Pasir Ris. Recovering COVID-19 patients or those with mild symptoms are hosted in such facilities to relieve the burden on hospitals. The facility has 2,700 beds, but there are plans to expand its capacity to 4,400 beds in the coming weeks. Patients here are able to conduct and record their own health checks 3 times a day. More than 10,400 patients are staying in community facilities as of Saturday noon, and that's about 3/4 of all COVID-19 patients in Singapore. But what makes Changi Exhibition Centre stand out? Well, the answer is technology.
This robot is the first of its kind being used in a community isolation facility. It distributes meals to the patients in what's called a red zone, now where only medical workers and maintenance crew are also allowed in.
We utilize robots so that will improve the efficiency of food delivery, and we can save up to 6 to 8 people that needs to work in the red zone. And using this robot, you can safely push the food timely to the patients.
More emphasis on the use of technology is being placed here.
That's right, yes.
Through this, patients can engage volunteers who can speak languages such as Hindi and Bengali. And for those with persistent symptoms, they can seek advice here without medical workers close by.
This is definitely much more efficient for us, but if we come from a patient perspective, most of the care need not be physically next to the doctor today. So the usual cough, cold and flu can be done at the convenience of even their bunk. We have 1 doctor or 2 doctors that can be physically stationed within the facility or even supported by the rest of the referral doctors that are off-site in the rest of Singapore.
Face masks, thermometers, toilet paper and other essential items are provided, and every room is designed to house 8 to 10 beds. Ventilation was a key element of the setup.
We have opened up all the doors to allow ventilation, and I think ventilation is extremely important for this facility. We wanted to make sure that the flow of the air gets pushed into one direction so that the area that air is being pushed into is also isolated and sanitized.
The facility has plans to expand to a capacity of 4,400 beds in the next few weeks.
Prime Minister Lee Hsien Loong says Singapore urgently needs a solution to house the large numbers of mostly mild COVID-19 patients. That's to prevent hospitals from being swamped. PM Lee says 4 halls at the Singapore Expo have already been completed and occupied, and 6 more halls will be ready soon. He says the pandemic has forced Singapore to improvise and come up with innovative, workable solutions on the ground, and that it's a constant trial and error to find the best way to help the most people in the shortest time. Mr. Lee adds that these community facilities allow hospitals to focus on more serious cases. Mr. Lee says Changi Exhibition Centre and Tanjong Pagar Terminal are being repurposed as such facilities. He adds that many have worked very hard to make this happen, and medical staff from both restructured and private hospitals have stepped forward to look after the patients in these facilities. To all, Mr. Lee expresses his heartfelt gratitude. And with foreign workers forming a majority of Singapore's COVID-19 cases, telemedicine firms are now hiring doctors fluent in different languages. And one such firm says it can do up to 10,000 teleconsultations in a day. The Health Ministry says more than 1,500 doctors and healthcare staff are trained in telemedicine. And it's also looking at how this can support Singapore's medical needs beyond the circuit breaker.
In the consultation about
Dr. Madhavi is fluent in Tamil, and she's playing a key role in this telemedicine firm's plans to reach out to patients of different nationalities. My Doc's app interface is already available in Mandarin, Thai and Vietnamese, for example. But it's looking to recruit more doctors who speak other languages as the pandemic drags on in Singapore.
Because of the current situations in Singapore, where we see a lot of cases coming up in the foreign workers populations, so we also go out and try to recruit doctors with different language capabilities, which include Tamil, Hindi, Bengali, Telugu, Malayalam, and also our local doctors are able to speak Chinese and English.
It has also partnered with other clinical groups, including pharmacies, to help them cope with any demand surge. And it's not the only one able to do more.
So we have huge network of providers on our platform. Assuming a doctor can serve 20 to 30 patients, we can easily ramp up to 100 to 200 doctors. So we're talking about a region of easily 4,000 to 5,000 patients quite easily. And of course, if there's a need, we can ramp up to even 10,000 a day.
Mana Doctor's also considering adding more language options to its app, like Tamil, which can be done in a matter of days.
We can also rely on translation tools to actually support us. It can actually cover most of the key languages in the world, especially with respect to medical terms. And we can also rely on visual cues. At the end, it's no different from what we have been doing face-to-face, you see. When we meet a patient of different nationality, speaking different language.
Firms say such tech is especially useful for frequent follow-ups needed for dealing with a virus with symptoms that take a while to show up.
By using telemedicine as a first point of contact before they go out and seek a doctor, actually we can bring down the burdens, the loads at our local healthcare institutions. It can be a hospital or it can be our polyclinics. So not every medical conditions requires a visit to the local GP.
Suspected COVID-19 patients can be sent straight from where they live to nearby public health preparedness clinics, for instance, to be swabbed. Several such clinics are already on board the app. Dr. Xiao also says waiting times can be cut to about less than an hour from the start of the teleconsultation to getting tested.